Hello everyone, welcome to the introductory seminar for the summer semester of third year. I'm going to cover pathology first, also known as pathoanatomy. So the entire course is quite similar to the winter semester. You have lectures and you have practical classes. And of course, at the beginning of every practical class, you're going to have a small micro or e-test on the iPad. To help yourself with these tests, or just for the practical class generally, you have Javi's summer sem notes, which are available on the drive, and at the bottom of the screen, that's the drive link in case you don't have it. For the credit, this is going to take place in the last two practical classes, and you can choose which date you want to do it on. And it's broken up into two parts. So you have the first part, which is an MCQ test, and the second part, which is your slide test. So the MCQ test is going to be 50 questions, and it's basically a compilation of all the micro tests that you've had at the beginning of the classes. And there are resources that are available on the drive. I highly recommend you go through those. Um, in order to pass this test, you have to get 80%, and then you can only move on to the slide test. In case you do not get 80%, you will not get the credit, and it's immediately considered to be failing the first attempt. So you can only have your second attempt, which is going to be like a week later. Um, I believe so. And in this case, you will not be doing the MCQ test, you'll only be doing the slide test straight away. Now for the slide test, this is a bit different from winter sem because now you can have a slide that is either from summer sem or winter sem. You're going to have two slides. You might draw two summer sem slides or two winter sem slides, and you have to identify your slides, like make your diagnosis, and then you have to talk about whatever you see or talk about the pathology. So there's a very useful master list that is on the drive. It has all the slides, all the differential diagnosis, relevant theory, and any details that you can see on the slide. So that's your best resource to work with. Now, just a little bit about the final exam. We will tell you guys a bit more about it when we approach the final, and if you guys would like, we can also have a seminar where we can discuss more details, how exactly to study for it, because it is going to be one of the biggest finals of your university life in this university. So the examination period, which you should keep in mind, is that it's at the end of May to the mid-September. And because it's one of the biggest exams, it will take time. And I'm assume, for me at least, it took a little bit over a month. It might take a month to a month and a half. But essentially, you have the pre-oral and then the oral. So the pre-oral is going to be an MCQ test, but the difference is that this MCQ test will only have one correct option. Unlike your normal MCQ micro test or credit test, where you can have multiple correct answers and you can select multiple options. So in this case, the trick doesn't work. If you know what I mean, you know. If you don't, I recommend just privately reaching out to me. So the list of dates will be given to all of you a couple of weeks beforehand, and you have to register on Moodle for what dates and time slot you prefer. I would recommend getting the pre-oral out of the way as soon as you can, because you have very good resources on the drive that can help you prepare for the pre-oral. And in case you do not pass the pre-oral, you've automatically failed your first attempt at the final exam. So your second attempt is not going to be the pre-oral, it's just going to be the oral straight away. For your oral, you're going to draw three questions, and you have the clusters, which are general pathology, CVS, oncology, and organ pathology. From these four clusters, you are definitely going to pull a question from CVS and oncology. So your third question may be either general patho or organ patho. It's because you pick these questions as triplets. So there are resources and experiences that are on the drive that can help you prepare for the final. There's a bunch of like notes for general patho, even CVS Steiner notes and onco notes. I recommend you go through the drive, see which notes work for you, and stick to one of them if you can. If you need to, you can go through multiple of them, but it's a little bit redundant. If you do attend the lectures, they can be extremely useful, especially for Professor Rishka, because he tends to highlight what is important and what is not. Another important thing is save your questions, and this document is going to be available on the drive as well. And these are questions which you absolutely have to know the answer to, and it can very much determine what your grade is. And we will tell you guys a bit more about this when we come towards the final. Apart from that, you also have Pathoma, which is a video, and a textbook, and you also have videos for explanation, and you also have the Robbins textbook. For ethics in medicine, this is a class that you're going to have towards the end, and it's basically 9 seminars which you have to attend. You need 80% attendance at least, and you can have one absence. And I highly recommend you shouldn't be late, especially if you have Professor Rudolph. But essentially, the credit condition for this class is the attendance and a little role play or a presentation that you'll be giving at the very last seminar. Yeah. So you'll be divided into groups that you guys can choose, and in your role play, you have to act out an ethical dilemma. So, for example, in my group, we did a dilemma about which patient should be getting a liver, an old man with some alcoholic history, or should be a young patient with potential, but there's some bribery involved, so on and so forth. And if you don't want to do a role play, you can just do a presentation, and it'll be in the last class of the seminar.
Hello, so I will continue on. So my colleague already talked about two of the subjects that you will have for the summer semester. I will particularly talk about pharmacology and the essentials of surgery, part one. So first and foremost, essentials of surgery one. It is divided, like the whole subject is divided into two parts. So one is in summer semester of third year, and the other is in the winter semester of fourth year, and that's when you'll have the finals. As for the summer semester, what you will have, the credit requirement is 100% attendance at the practical trainings, and it is important to attend because they do take attendance at the beginning of every practical. So there's, like, if you think that you are going to be absent, it's best if you inform the department, particularly the secretary, in advance, and perhaps they will see or find out a way to like schedule an alternative class or a replacement class for you. And it is of utmost importance also that you continuously check your emails for information from the department, like communication between them, because they send emails regarding your groups, your schedule, which group will be at which practical class and where exactly. And I believe the email also contains like a PowerPoint presentation about like the layout of the Department of Surgery so that you can navigate yourself properly. As for the recommended literature, well, to be honest, since attendance is the only credit requirement, it is not really necessary for you to like extensively go into the subject, but there is like a Moodle course for Essentials of Surgery. It is highlighted in the text there, and you can also see the syllabus over there for practical exercises that you will have in as subgroups. Then you also have the Essentials of Surgery final notes that are available to you in your Google Drive, and it's not really, again, of the utmost importance to go through it now. It is best if you go through it at least for the winter semester final exam. And also there are some textbook recommendations by the department for which you can see the student information system. And this is how you access the Essentials of Surgery course. So you go to Moodle, and then you have the English courses, obviously, and then the Academic Department of Surgery, followed by Essentials of Surgery. And then you go there, you go to study materials from there. I believe the e-learning part is blank for now. And next up, pharmacology. So similarly to Essentials of Surgery, pharmacology is divided into two parts. You have one in the summer semester and one in the winter semester of fourth year. And it is like one of the more important subjects that you have to tackle. So first and foremost, the credit requirements, um, attendance for the practical classes, not the lectures. So one absence is allowed, and it doesn't matter if it's documented or not. And you really won't be tested on what was like what you missed in that absence. It's done and dusted. And then you have, if you have two absences, then you will be examined in detail on the issue or like the lesson of both missed practical classes in order to receive the credit. And if you have three or more absences, then you will be tested orally for the entire semester. So whatever was covered from practicals 1 to 7 or 8, I don't remember exactly how many classes there were for pharmacology. So you will be tested orally for the entire semester, and you must also provide documentation as to why you were absent. You can't just miss classes just because you wanted to. As for the second important credit requirement, it is the test. So at the end of each pharmacology practical, you will be writing an MCQ test on a tablet, and it is basically statements that is followed by a yes and no, or true and false, basically. And at the end of the test, once you submit it, you will get your grade. So it's similar for the other tests where there's 1 to 4, and 3 obviously is a pass. And you must at the end of the semester have an average of greater than 3 to pass the to meet the credit condition. And the way you can keep track of what your average is, you can go to the student information system and then the study group roster, and from there you can just keep track of your averages, or you can just note it down somewhere and calculate your own average. It is important to note that, let's say there's 8 practical classes and you miss one, your average will be calculated on the basis of 7 practical classes, not like the one you missed. So the one you missed is basically like ignored. It's not taken into calculation. And finally, you have to actively perform, like basically answer questions, be an active participant of discussions during your pharmacology classes or seminars. There is another important thing that I want to highlight is that for the final exam in winter semester or fourth year, you have two parts. So there's a pre-oral, which consists of 90 to 100 questions, and there's the oral part. And in the oral part, you draw two questions, one from general pharmacology and one from special pharmacology, which is essentially the bread and butter of pharmacology. Now, I believe for our year, special general pharmacology had 22 questions and special pharmacology had 58, something like that questions. So if your average in the summer and winter semester is better than 2.0, keep in mind that the condition to pass is 3.0, but if it's better than 2.0 and it is followed by a 1 or a 1 minus in the pre-oral that you have during your final exam, then you only get to draw a general pharmacology question. You basically cut your exams load like during the final exam in, well, I wouldn't even say half, I would say like you cut 70 to 80% off your exam. And I would highly recommend that you try and attain this bonus because it really makes the exam a much more of a smooth ride than an actual final exam. It is also somewhat of an incentive for the students to study that is provided by the department. Regardless, even if you go into the final exam, you have to study the entirety of pharmacology. You can't just study general pharmacology and hope that you will get the bonus, because for the bonus, you also have to answer questions from special pharmacology that is in your pre-oral. And the recommended literature for pharmacology is, I would emphasize lectures. They basically contain all the information that you will need and all the information that the department expects from you. And most of their lectures are available as video lectures that are present, like provided on Moodle. And sometimes the professors that are providing the lectures also highlight what exactly they expect students to know during the final exam and what they don't, like what is like accessory information, I guess. And they highlight the importance of knowing at least two examples from each drug class, if provided, at least two examples. And there's also another resource on YouTube known as Speed Pharmacology. And this YouTube channel basically goes through very quickly in a matter of 10 to 20 minutes the entire class of drugs, not to the extent that the Department of Pharmacology expects you to know, but well, it is a good source of priming, I'd say, because the Department of Pharmacology provides lectures in depth to like the extent that they expect you to know in the final exams, and it might feel very overwhelming when you're going into like a presentation that has like 100 or 120 slides. So I personally, what I would recommend is for preparation of the tests, you watch a speed pharmacology video, understand like what the drug class is and like basic indication, contraindications, side effects, and then you watch the lecture so that you sort of have an idea of what exactly they will discuss and emphasize on in the lecture videos. And there's some other YouTube channels as well that you can resort to, whatever helps you. Then there's another resource that is uh, for particularly for students studying for the USMLE, but you can use it even as well a medical source to study for pharmacology, and that is Kaplan. And this person uploads or provides videos, each of which is like 3 to 4 hours long, but it basically tackles the whole of pharmacology subject and in a rather clinically relevant way as well. And then there's a pharmacology textbook that's provided by Kaplan too, if you guys are interested. And then we also have sketchy pharmacology. So most of you are probably sort of familiar with sketchy because you've done microbiology, and a very how to say this popular way of studying microbiology for the students in our university is to resort to sketchy microbiome. So similarly, you have sketchy pharmacology, albeit the videos are not as short as in microbiology, where they would max extend up to 18 to 20 minutes. I think that was the HIV video. But in pharmacology, majority of the videos are very long, very lengthy. That's 20 to 30 minutes, I guess, and reasonably so because there's a lot that you discuss for in pharmacology. So it might not always have sufficient information. So I would recommend that if you do use sketchy pharmacology for the memorization's sake, at least go over the lectures and sort of see what the lecturers or the professors think is important in it that is not provided in sketchy pharmacology. And then finally, you have textbooks such as Lippincott, Rang and Dale's. You can use them to make your learning better, but honestly, if you're using the lectures, YouTube, and the other resources, the textbooks sort of become accessory. The other resources do a better job, I would say, at not only explaining the concepts, but also like drilling it into your heads. And that is all the information that I have for you now.
Hello everyone. So I'm just going to discuss a few points to keep in mind about pathophysiology and internal medicine for this coming semester and how to approach the stuff in just a few tips and stuff you should keep in mind. So speaking of pathophysiology, as you all know from the last semester, the main resource you should be using is Scripta, which is available on Moodle, as well as Amboss. I recommend you have a look here and there if you feel like certain information is lacking. Amboss is a really good resource. They have a bunch of pictures, diagrams, mind maps, etc. That can be very helpful to help you understand things and even look up symptoms and stuff like that. Speaking of credit requirements, there's three things you're going to need. One, to pass all the credit tests successfully. Two, there will be a case report at the end of the semester. So the case report is nothing serious. It will basically be like you pick a disease that you want to present, and then the case report is designed in such a way that you speak about the patient, their presentation, you give their lab exams, etc., and then your classmates are going to guess what disease the person has. So everyone has to do one of these, and it's pretty simple, just about a 7 page PPT, I believe, and yeah, that's all there is to it. And then attendance is super important for your practical classes as well as your lectures because they do keep track of this and it can affect your grade and they might bump you up from like a 3 or a 2 if you have been attending all the lectures, so please be sure to attend them. And even the practical classes, please like excuse yourself in advance through email or something and keep a track because there were cases in our year where people had to give an additional credit test for when they had more than the required number of absences from practical classes, so please keep that in mind. As for the credit test, I know that you already have an idea about it from the previous semester, so you study in a similar way for it. Just use Scripta and be prepared well in advance, attend the lectures and listen to what they're saying because they might say some stuff that's not written in Scripta, but you would need that information for the final exam as well as the credit tests. As for the ECG test, it says on Moodle that you guys do have one in your practical classes, but I'm not really sure what would be the amount of stuff tested on this because you've already had 2 ECG tests the previous semester. So we'll try to get further clarification on that, and I recommend you guys even ask Professor Kuba or Professor Kububa about it. So yeah, that's pretty much it about the credit requirements. Then points to note, like I've already mentioned, attendance is really important. And additionally, please be consistent. I know that it can seem like there's a lot of credit tests, and for some of them towards the end of the semester you might get a bit lax, but the more consistent you are, like throughout, the lesser work you will have in the end, and you will remember everything better, and you will have better formed notes, resources, etc. for it. So no matter how hard it seems with everything, just try and study properly for each credit test, and trust me, it's going to make your life much easier. As for the final exam, now the prep time, it really depends on individual preference. The thing about Pathophys is that they start the exam period pretty early. So it can start, for us, the dates began around 29th of May, I believe, and they went all the way up to July. But do keep in mind that the dates will be more uh, often in June compared to July, because they prefer that you give the exam in June before pathoanatomy. So if you do plan on giving the exam early, then it's even more important for you to be more consistent so that you can squeeze in enough time for your final revision, because you're going to have a bunch of tests happening in May. You'll also have the credit test from pathoanatomy, so you need to plan this out in advance if you do want to give the exam early, and not something that you decide after the dates open up. So yeah, so as for the prep time, like some people gave it 2 weeks, then there were others who gave it around 3 to 4 weeks. So it's really down to individual preference. But I would say like around 2 weeks is it's a good amount of time. Don't give yourself too much time because you'll get lax, and don't give yourself too less because you'll be stressed. But you should be knowing this already after giving 3 years worth of final exams. Some other points to note, like I've already mentioned, try to involve small amounts of revision throughout the semester so that in the end your load is lesser and you're better prepared, because topics such as GIT, endocrine, there's a lot of information, and it's easy to forget. And then topics such as CVS and pulmonary, which are like super important and they tend to overlap with everything. It's important that you get a good handle on these topics. Then coming to how you study. So the thing is, the way you'll be studying for the credit is very different from the way you approach your final. On a credit test, you're focused on memorizing these facts and just like remembering the words of scripta and reproducing it, because that's what it tests. But during a final exam, there's going to be a lot of back and forth. There's going to be a lot of jumping across topics, and you need to be prepared for that. So it would be useful to change the way you study a bit. And like whenever you're studying something, and oh, if it references something from, let's say, CVS, you should go back and read up on that, maybe like heart failure or an MI or something. And whenever a pathology is mentioned, try and derive how it occurred, how it's happening, and uh, try and link it to other things, like I said earlier. I'm not sure how to explain it, but when we do have our seminars eventually for uh, the given like credit tests or whatever, um, I think we'll be able to talk about that more and maybe build up on these concepts. But it's very important to like try and connect things continuously. Don't think in a linear way. And lastly, like definitely focus on what is said during lectures and practicals, because they're super important. Um, they often say things that are not maybe written in the presentation or not in scripta, but they might expect to hear this from you during the final exam, or it might show up on the credit test as well. So be sure to do that. Okay, coming to internal medicine. So, the organization of the material in the studies, it's pretty similar to how it was for clinical examination, which was a subject previous semester. So you basically have seminars and practicals, and attendance is compulsory for both of these, and they might come in anytime with their sheets to check. So do make sure you're present on time. And you have two absences, and be sure to use the absence form and inform them in case you are going to be absent for either the seminar or the practicals in advance. Coming to the credit requirements, please be sure to complete the modal tests on time before the seminars, because there were many people who didn't do so, and then they had to write an extra credit test at the end of the semester. So please don't forget about that. Then the absences, like I mentioned earlier. And then lastly, you will have a credit test at the end of the semester. So we will communicate with you about additional resources surrounding this credit test on your groups. But the topics covered by this will be cardiology, pneumology, and I think a little bit of CPR and general, like the BLS and the ABCD approach and stuff like that. As for the resources, AMBOSS is a really good resource for internal medicine. It has everything you need summarized on it. So, what I'd suggest is like if you have a seminar the next day, let's say on, I don't know, MIs or ventricular abnormalities or some sort of arrhythmias and stuff, I recommend you at least try to read up in the morning before the class or the day before to get a picture, and that way you'll be more well informed when the classes are occurring and you'll be able to ask and answer questions, etc. There are also textbooks like Kumar and Clark's and the Oxford Handbook of Clinical Medicine, so you can refer to those as well. The Oxford Handbook, it's more practical than it is theoretical, so it has stuff about patient examination. So in case you do have questions about how to approach that, you can have a look at that and sort of get a better idea. So tips like I already mentioned, like try to read up before class. I know it can be hard with pathoanatomy, pathophysiology, and you will have pharmacology as well. So it's a bit hard to juggle everything, but it will be useful for you. So try and do that. And another thing I feel like a lot of people may not focus on is that when you go to take the history from the patient during practicals, it tends to be all over the place because I understand there is a language barrier with us having to like communicate and check and stuff. But try and have the same systematic approach that you would have had for the clinical exam final over here as well, and always go in a particular order. So you go to the patient, you ask them what brought them to the hospital, they're presenting complaints, maybe try and get the history of the presenting complaint right there, or you can do it later depending on you, and then get all the other family history, social history, etc. And then lastly, also do a review of systems. It may seem excessive. I don't know if you will have the time because sometimes the doctors want you to rush up. But if you do have the opportunity, it's really good to practice these skills, and yeah, and like you should try and soak up all the experience you get. And the examination order as well, go in a systematic way. Like if you're doing a cardiac exam, do the inspection, palpation, everything, and palpate as much as you can for the heart, but yeah, and the auscultation. And it would also be smart to like review the stuff that was mentioned in Grada and the notes and everything for the previous semester about the heart murmurs, the kinds of sounds, because this is what you'll see in the patient. So it would be wise to go over stuff like that. I know stuff like the heart murmurs and the sounds that can be a bit elusive and require you to revisit it many times. So it will help you. And lastly, ask questions whenever you're confused. Everyone's there to help you. And if you feel like something's unclear or you want to see something that you have not seen yet during the practicals, then the doctors are always ready to help. So be sure to ask questions. And yeah, I think that's it. Another thing I wanted to note is the credit test is 70% to pass, but if you complete the Moodle tests on time, they did mention on SIS and on Moodle that there is a 10% bonus, so that would mean you would also pass even if you got 60%. But I don't know if that's still the case. So you should email the secretary and confirm things like that. And it would also be wise to confirm if you have an ECG test or not, because I'm not sure if it's present because Moodle and SIS, again, they don't have the same information out there. So those are some things you should email the department and figure out. But yeah, that's it. And if you have any questions, you can always reach out to us and all the third year education representatives. And I hope all of you have a successful semester ahead. Thank you.